As we get older, our health deserves more attention and care. Many of us take blood pressure medication every day to protect our heart, stay active, and continue living life with independence and peace of mind. One of the most common medicines doctors prescribe for blood pressure in the United States is amlodipine. It helps millions of older adults every year, but like any medication, it can have side effects that are important to understand. In this video, we are going to talk about the side effects of amlodipine that seniors should be aware of. The goal is not to make you afraid or to tell you to stop your medication. Absolutely not. The goal is education. When you know what signs to look out for, you can talk to your doctor early and take care of your health in the safest way possible. Before we move forward, please tell me in the comments, how long have you been taking blood pressure medicine? Less than a year, 2 to 5 years, or more than 5 years? Your answer may help someone else feel supported too. Point 1. Swelling in feet and ankles, peripheral edema. One of the most common side effects older adults experience with amlodipine is swelling in the feet, ankles, and sometimes lower legs. Many seniors describe it as their shoes feeling tight by the end of the day or noticing marks on their skin after removing socks. This happens because the medicine relaxes blood vessels to lower blood pressure, but for some people, especially those over 60, it can also cause extra fluid to settle in the lower part of the body. You may notice your legs feeling heavy or tired, or that walking feels a little different. Some people say their legs seem puffy, or that it gets harder to put on their regular shoes. This type of swelling usually appears slowly, over days or weeks, so it can be easy to ignore. Many older adults assume it's simply aging or just the heat, but it's important to pay attention. If you notice swelling, do not panic and do not stop your medication on your own. Instead, monitor it. Check your feet in the morning and evening. Sit with your legs raised when resting, and avoid sitting in one position for too long. Sometimes, doctors adjust the dose or add another medication to help manage the swelling. They may also check for other causes, like heart or kidney issues, just to be safe. Point 2. Sudden facial or throat swelling, angioedema. Another important side effect older adults should be aware of is sudden swelling in the face, lips, tongue, or throat, known as angioedema. This reaction is rare, but it needs your attention because it can affect breathing. Most people taking amlodipine never experience it, but it's important to know the signs, especially as we age and our body may respond differently to medication. Angioedema usually appears quickly. You might feel tingling or tightness in your face or throat before swelling starts. Some people notice their lips looking fuller or their eyelids puffing up. In more serious cases, swelling inside the throat can make it hard to swallow or breathe. If you ever feel like your throat is closing or breathing becomes difficult, call 911 immediately. This is not something to wait on. Sometimes, mild swelling goes away on its own, but because it can become serious, it is always safer to speak with your doctor right away if you notice these symptoms. Do not stop the medication suddenly unless a medical professional instructs you. Your doctor may decide to switch your medication or prescribe something to manage the reaction. Many older adults tell themselves, maybe it's an allergy, or maybe I just ate something wrong. But when you're taking medication, it's always wise to check. Trust your instincts. If something feels off, your doctor is there to help. Early action keeps you safe and gives peace of mind. Point 3. Liver stress and warning signs. While uncommon, amlodipine can sometimes affect the liver, and this is especially important for older adults because our liver becomes more sensitive as we age, and many of us take several medications daily. The liver's job is to clean the blood and break down medicines, so when it feels overwhelmed or irritated, it sends quiet signals, and these signals should never be ignored. The signs of liver stress can be subtle at first. You may feel more tired than usual, lose your appetite, or notice nausea or discomfort in the upper right side of your stomach area. Some people also experience darker urine or lighter stool color. One of the most important signs is a yellowing of the skin or eyes, called jaundice. If you ever notice this, contact your doctor right away. Most seniors don't immediately think of medication when they feel tired or weak. We often say things like, maybe I'm just getting older, or maybe I didn't sleep well. But paying attention to new or unusual symptoms helps catch problems early. The good news is that if liver issues do happen, they usually improve once the medication is adjusted or changed by your doctor. Never stop amlodipine suddenly on your own, always discuss changes with a healthcare professional. Point 4. Tingling, burning, or numbness in hands and feet, peripheral nerve changes. Another side effect that some older adults may notice while taking amlodipine is tingling, burning, or numbness in the hands, feet, or legs. This happens because the medicine can sometimes affect the nerves that help us feel touch, balance, and temperature. For many seniors, these sensations start slowly, maybe a light, pins and needles, feeling in the toes, or a warm burning feeling in the feet at night. Over time, it may become more noticeable. At this age, it's easy to blame these feelings on poor circulation, diabetes, or simply getting older. But if these sensations began after starting blood pressure medication or after a dose change, your medicine could be playing a role. Some people also feel a slight loss of balance or have difficulty walking on uneven ground. This is important to pay attention to, because balance problems increase the risk of falls, and protecting mobility is essential for staying independent. The good news is many people feel better once their doctor adjusts the dose or changes the medication. If you notice these feelings, it doesn't mean you have to stop your medication suddenly, just bring it up at your next appointment or call your doctor if it's getting worse. You may also try simple steps like gentle foot stretches, wearing supportive shoes, or staying physically active to help circulation and nerve function. Point 5. Muscle stiffness or shaking. Some older adults may notice unusual muscle stiffness, shaking, or difficulty controlling movements while taking amlodipine. This is not very common, but because it can affect daily comfort and independence, it's important to recognize early. You might feel tightness in your neck or shoulders, shaking in your hands when resting, or small muscle twitches that you didn't have before. In a few cases, the muscles may feel locked or tense, making normal activities like writing, holding objects, or even walking feel different. At this age, many of us already deal with joint stiffness or mild tremors, and it's easy to assume it's part of aging. But if these symptoms started after taking amlodipine, they may be related to the medicine. Sometimes the body reacts to changes in how nerves and muscles receive signals, and this can create stiffness or shaking. These symptoms may come and go, or they may slowly increase over time. If you notice new movement changes, do not ignore them and do not stop the medication on your own. Instead, make note of when the symptoms happen, morning, evening, or after taking your pill, and speak with your doctor. Your provider might adjust your dose or switch to a different medication to help relieve these effects. Gentle stretching, light walking, and staying active can also help keep your muscles loose and strong. Point 6. Chest discomfort, dizziness, or irregular heartbeat. Amlodipine is meant to protect your heart, and for most older adults, it does. But in some cases, especially when the body is adjusting to the medicine or the dose is changed, you may feel unexpected heart-related symptoms. These can include mild chest discomfort, fluttering sensations, a racing heartbeat, or feeling unusually lightheaded or dizzy when standing up. Some seniors describe it as, "My heart feels like it's skipping," or "I stood up too fast and the room moved." These sensations can be worrying, and it is very easy to confuse them with normal aging or everyday tiredness. But if something feels different in your chest, it's always worth paying attention. Amlodipine relaxes blood vessels, which lowers blood pressure, but in some people, the body may respond by increasing heart rate temporarily. For others, the blood pressure may drop a little too low, causing dizziness, weakness, or even fainting if they stand up quickly. If you feel sudden heavy chest pain, shortness of breath, or pressure spreading to the arm, back, or jaw, call 911 immediately. Never wait with symptoms like that. But if you notice milder, ongoing changes, like gentle fluttering, occasional dizziness, or unusual tiredness, contact your doctor and let them know. They may check your blood pressure, adjust your dose, or choose a different medication that suits you better. Point 7. Changes in taste or loss of appetite. Some older adults who take amlodipine may notice changes in their sense of taste. Food may start to taste bland, metallic, or not the same as before. In some cases, people notice that they simply don't feel hungry like they used to. These changes can sneak up slowly, and many seniors think it's just aging, or they blame stress or dental issues. However, medications, including amlodipine, can sometimes affect taste signals and appetite, especially in older bodies that are more sensitive. Losing interest in food might seem harmless at first, but for seniors it can lead to weakness, low energy, and unintentional weight loss. These things make daily tasks harder and can reduce muscle strength, which is important for balance and staying independent. Some older adults also eat less to avoid cooking or because they simply don't enjoy meals the way they used to. When medication adds to that, it can become a concern. If you begin to notice that food tastes different, or you are eating less than usual without trying to, talk to your doctor. Sometimes adjusting the dose or switching medications helps your taste return to normal. In the meantime, try eating small nutritious meals, staying hydrated, and choosing foods with natural flavor, like soups, fruits, warm oatmeal, or lightly spiced dishes. Eating slowly and enjoying meals with family or friends can also help. Point 8. Gum swelling or overgrowth. Amlodipine can sometimes cause changes in the gums, especially in older adults. One possible effect is gum swelling or gum overgrowth, where the tissue around the teeth becomes thicker or puffy. Many seniors first notice this while brushing or flossing. The gums may feel tender, look fuller, or bleed more easily. It may also feel like food gets stuck in the gums more often, or that the teeth don't feel as clean as they used to after brushing. This side effect can appear slowly, sometimes weeks or months after starting the medication, so it can be easy to overlook at first. Many older adults already deal with dry mouth, dentures, or dental sensitivity, so gum changes might not seem unusual. But paying attention matters. Healthy gums are important for comfort, chewing, and overall well-being. When gums overgrow, it can make brushing difficult, which may increase the chance of dental infections or irritation. The good news is that if gum changes are caused by the medication, your doctor or dentist can help manage it. They may adjust your dose, switch medicines, or recommend specific dental care steps. Regular dental checkups, soft bristle toothbrushes, gentle flossing, and good mouth hygiene can make a big difference. Rinsing with warm salt water and staying. Point 10. Skin rash or unusual skin reactions. As we get older, our skin becomes more delicate and sensitive, so it's especially important to pay attention to new skin changes while taking medications like amlodipine. Some seniors may notice a mild rash, small red spots, itching, or raised bumps, shortly after starting the medication or after a dose change. Others may see dry patches, increased sensitivity, or skin irritation that doesn't go away with regular moisturizing. Most skin reactions are mild and harmless, but it's still important not to ignore them. Amlodipine can occasionally cause stronger reactions that spread or feel uncomfortable. If you ever see a rash that spreads quickly, feels painful, forms blisters, or comes with fever or swelling, contact your doctor right away. Although rare, serious skin reactions require immediate attention. For everyday mild irritation, staying hydrated, using gentle fragrance-free lotions, and avoiding overly hot showers can help. Soft clothing and fabrics that don't rub or irritate the skin are also comforting. If you're unsure whether a rash is from the medication or something else, like laundry detergent, soap, or even dry winter weather, your doctor can help determine the cause. Point 11. Warm redness or flushing in the face and neck. Another side effect some older adults may experience with amlodipine is flushing, a sudden feeling of warmth, usually on the face, neck, or upper chest. You may notice your cheeks turn red, you feel heated even in a cool room, or you suddenly start to sweat lightly without any physical effort. This can happen shortly after taking the medication or at random times during the day. For many seniors, this sensation can feel surprising or uncomfortable the first time it happens. Some people describe it as a rush of heat, while others say they feel like they're blushing or warming up from the inside out. While flushing itself is usually not dangerous, it can be bothersome, especially in social settings or when you're trying to relax. If the flushing episodes are mild and happen occasionally, simple steps like drinking cool water, sitting in a comfortable position, and avoiding overly warm rooms can help. Wearing breathable clothing and staying hydrated also brings relief. However, if flushing becomes frequent, intense, or comes with dizziness, rapid heartbeat, or difficulty breathing, be sure to let your doctor know as soon as possible. This symptom often improves once your body adjusts to the medication, but not always. Your doctor may adjust the timing or dose, or recommend changes based on how you feel. Remember, medication should support your comfort, not disrupt it. Point 12. Constipation or slower digestion. As we age, our digestion naturally slows down a little, and many seniors already face constipation from time to time. Amlodipine can sometimes make this more noticeable by relaxing the muscles in the digestive system, which can slow movement in the intestines. This may lead to harder stools, less frequent bowel movements, or a feeling of not being fully relieved after using the bathroom. Constipation may sound like a simple problem, but for older adults it can be quite uncomfortable and even interfere with daily life. Some seniors also feel bloating, stomach discomfort, or lose appetite because they feel backed up. We often think constipation is just part of getting older, but when medication adds to it, it's worth paying attention. No one should feel uncomfortable or struggle quietly with digestive issues. If you begin to feel constipated while taking amlodipine, talk to your doctor, especially if it continues or becomes painful. Do not stop your medication suddenly. Your provider may suggest dietary changes, such as adding more fiber, oatmeal, fruits, vegetables, or whole grains. Drinking enough water, taking gentle walks, and keeping a regular bathroom routine can help your body stay regular. Warm herbal tea or prunes can also be very soothing and natural solutions for many older adults. Constipation is common, and there is nothing embarrassing about discussing it. Good digestion keeps your body strong and your energy steady. By noticing early changes and taking care of your gut health, you protect your comfort, mobility, appetite, and independence. As we get older, taking care of our health means listening to our bodies and staying aware of how medicines affect us. Amlodipine has helped millions of older adults control blood pressure and protect their heart, and for many, it works very well. But knowing the possible side effects gives you strength. It gives you confidence. It helps you catch small problems early, before they become big ones. You have worked hard your entire life. You deserve good health, peace of mind, and comfort as you enjoy each day. Never ignore your body's signals, and never hesitate to speak up. You know yourself better than anyone. Thank you for taking time to learn and take care of yourself today. Your health matters. Your life matters. And your voice matters.